Hi, I'm Daniela. I'm a movement specialist and Feldenkrais practitioner. And here are some examples that I want to give you that you might want to try out. There are typical Feldenkrais movements. And make sure you follow us also on Facebook with updates about our services. This is an exercise that can help you tremendously with your low back pain. It's a hip flexor release. So what you do, you lie on your back, you put a half foam roller or a rolled up towel underneath your sacrum, right on the bottom of your spine. Once you're there, you bring one knee up over your chest, you lightly hold it with your hands, and then you stretch out the other leg slowly. In this position, the first part, you bring the knee up to your chest, slowly, and you feel that you're rounding your low back a little bit to the table. So first you're really stretching a little bit the low back on the table here, and you just wait until it softens a little bit. Then you let go. And then the second part is you bring the thigh towards you without the rounding of your back. So first we round, second you don't round. You keep that arch, and that's why the roller is here. So basically your pelvis does this, forward. So you stay there, we call this neutral position, and into this neutral position, you fold your your leg up, so you tighten inside this hip joint. It's a positional release that helps the brain stop the muscle engagement in your hip joint. So you just hold it there. That's all you do. You hold it and wait and soften inside the hip joint until you feel like it's a little looser. And then when it lets go, maybe after a minute or two, or depending how tight you are, it might take longer, you slowly let the leg go down. And then you want to compare that this hip is more open than the other one. Then you bring the other leg up, same thing on the other side. First, you start by rounding. See how this rounds and it goes up to my chest? You do that a couple times slowly. And then after you do that a couple times, you arch your back forward or you keep it neutral. And in this neutral position, the only thing you move is your leg. So you tighten the hip joint. You hold it there for a minute or two. You really wait until the hip flexor, the big muscle that attaches to the spine, lets go. That will pull you forward with every step when you're walking, so you want to make sure that it's not too tight. And this is an indirect way to release it. Okay? Then you slowly let go. Bring the foot to stand. And then you bring the foot down and feel how this opened the hip. Make sure when you take the roller out, you bring your legs back up, bring your spine down, and you feel much more flat lying on your back.